YouTube channel. Today we'll discuss the anatomy of tibia. Okay, now let's discuss the anatomy of tibia. External features of tibia. Tibia is divided into the three parts: upper end, middle end is the shaft, and the lower end. Upper end is expanded. This is the expanded part of the tibia, which contains the two condyles. This is the medial condyle. This part is known as the medial condyle, and this part is known as the lateral condyle. Medial condyle is larger as compared to the lateral condyle. At the anterior part, having one tuberosity is there, and this tuberosity is known as the tibial tuberosity. This is known as the tibial tuberosity. The area in between the two condyles is known as the intercondylar area. This area is known as the intercondylar area, and the part or the area which is known as the lateral meniscus and the medial meniscus. The lateral meniscus and the medial meniscus, and in between that, and here is the intercondylar area is present. Now come to the shaft. Shaft is divided into the or contain three borders and three surfaces. First borders, this is the sharpest border, is known as the anterior border or also known as the sheen. Okay, this is the sharpest border. Then this border is known as the medial border. This border is known as the medial border, and this border is known as the lateral border or also known as the interosseous border. That is the lateral border. Now come to the three surfaces. The surface in between the anterior border and medial border is known as the medial surface. This is throughout cutaneous surface. Okay, the surface in between the anterior border and the lateral border is known as the lateral surface. This is the lateral surface, and the surface in between the medial and lateral border is known as the posterior surface. This is the posterior surface. In the posterior surface above, one line is there. This line is known as the soleal line. This line is known as the soleal line, and here is one nutrient foramina is there, from where largest nutrient arteries passes. It is a branch of posterior tibial artery. Is a branch of posterior tibial artery. Now come to the lower part, lower end, which contain a projecting part which directed downward and forward, is known as the medial malleolus. This part is known as the medial malleolus. Now the lower end, which contain the five surfaces. This is the anterior surface, behind posterior surface, then lateral surface. This projection medial malleolus is the medial surface, and the inferior surface which attached to the talus and form the ankle joint, which attach to the talus and form the ankle joint. So this is the external features of the tibia. Now let's discuss the side determination of this tibia. Either it is left side or either it is the right side. First, the upper end, it is the expanded, so it is the upper end which is expanded. This tibial tuberosity is always directed anteriorly. This tibial tuberosity is always directed anteriorly. Anterior border is shaft, anterior border is shaft, and the lower end is the medial malleolus, which is directed, projected medially. Okay, so according to this, this is the right side of tibia. This is the right side of tibia. First, the attachment of tibia. First, upper end attachment. This is the tibial tuberosity. On the tibial tuberosity, upper part, attachment of the ligamentum patelli. It is attachment of ligamentum patelli, and lower part of the tibial tuberosity is subcutaneous. It is the subcutaneous. The medial meniscus and lateral meniscus area, which are articulate with the medial and lateral condyle of the femur and form a knee joint. Area in between the two condyles is known as the intercondylar area. It's known as the intercondylar area. In the intercondylar area, attachments are anterior to posterior or before backward attachments are first, that is the anterior horn of medial meniscus, then anterior cruciate ligament, then attachment of anterior horn of lateral meniscus, then posterior horn of lateral meniscus, then posterior horn of medial meniscus and posterior cruciate ligament. These are the attachment of intercondylar space or intercondylar area. Mnemonics for this: Medical College London, London Medical College. Attachment of the shaft. This is the medial surface. This medial surface is subcutaneous throughout, okay, but upper part of the medial surface, attachment of the three muscles, these are inserted on that part. First, that is the sartorius muscle, then gracilis muscle and semitendinosus muscle. These three muscles come from the three different compartments. That is sartorius muscle, which comes from the anterior compartment of the thigh. This is the gracilis muscle, which comes from the medial compartment of the thigh. This is the semitendinosus muscle, which comes from the posterior compartment of the thigh. So three different compartment muscle comes and inserted at the upper end of the medial surface. This collectively known as the gyro. This collectively known as the gyro, and these are separated from by each other. Bursa. This bursa is known as the Anserian bursa, separated by a Anserian bursa, and the area where semimembranosus muscle is inserted. Semimembranosus muscle is inserted. Now the lateral surface upper part, origin of the tibialis anterior muscle is there. Origin of tibialis anterior muscle from the lateral surface. Come to the posterior surface of the tibia, the soleal line. From the soleal line, soleus muscle is originated. Soleus muscle is originated. Above the soleus muscle, the area from where popliteus muscle is inserted. The area above the soleal, insertion of popliteus muscle is there. Okay. Below the soleal line, origin of tibialis posterior muscle. Origin of tibialis posterior muscle below the soleal line. Now the lower part of the tibia of the posterior surface, origin of flexor digitorum longus muscle. Origin of flexor digitorum longus muscle. Lower end, this is the projection is directed downward and forward, is known as the medial malleolus. Okay. So inferior surface of lower end, which attach to the talus and form the ankle joint, Now the anterior surface of the lower end, which are articulate medial to lateral attachment. The mnemonics for the medial to lateral attachments are: the Himalaya are never dry places. T for tibialis anterior muscle, H for extensor hallucis longus muscle. The Himalaya are A for artery, that is anterior tibial artery. Never, N for nerve, that is the deep peroneal nerve. Himalaya are never dry. D for extensor digitorum muscle, and places, P for peroneus tertius muscle. So the Himalaya are never dry places. Now of the posterior surface, attachment medial to lateral are: talented doctors are never hungry, that is the mnemonics. Talented, T, that is the tibialis posterior muscle. D for the flexor digitorum longus muscle. A for artery, that is the posterior tibial artery. N for the nerve, that is the tibial nerve. And talented doctors are never hungry. H for flexor hallucis longus. These are the attachment of the lower end of the posterior surface. Okay. Now come to the ossification of this tibia bone. Tibia is ossify one primary center and two secondary center. One primary center for the shaft which are at the age of 7th week of intrauterine life. 7th week of intrauterine life. Now upper end which of one secondary center which are appear at the birth and fuse with the shaft at the age of 18 years. One secondary center for the lower end which are appear at the age of 7 years and which are fused to the shaft at the age of 15 to 17 years. These are the ossification, one primary and two secondary centers for the tibia. Now let's discuss the applied anatomy or clinical anatomy of this tibia. The upper end of tibia is most commonly infected and this is known as the acute osteomyelitis. This is known as the acute osteomyelitis. The medial surface is more subcutaneous, so surgeon are use this part of piece of tibia for the bone grafting purpose. So this part is used for the bone grafting. Okay, so the fracture of tibia is more common at the junction of upper 2/3 and lower 1/3. At the junction of upper 2/3 and lower 1/3 there is the fracture of tibia is common. So this is all about the tibia. Thank you very much for watching this video.